Hey guys, it's Dr. Lifer with Motos Chiropractic, and today we're going to be talking about sciatica. We're going to talk about what sciatica is, why you may have it, and also, most importantly, what we can do to treat it. Really quickly, I just wanted to talk a little bit about sciatica versus sciatica-like symptoms. So, when we're talking about sciatica, we're talking about the sciatic nerve being compressed, right? And a lot of other conditions produce sciatica-like symptoms. And sciatica-like symptoms refers to really that radiating pain down the leg. We can have disc herniations, we can have facet arthropathy, right? We can have ligamentum flavum hypertrophy, we can have all these other things that are affecting the nerve root that cause sciatica-like symptoms that are not sciatica, okay? And it's important to bring up that point because as we start talking about treatments and things that we can do to help relieve that pain, these stretches and exercises aren't going to help it if it's not sciatica, okay? So if you're doing these exercises and nothing seems to help or it aggravates the problem, then that may be because it's not true sciatica and then it's a sciatica-like condition. All right, guys, so here we got a spine. We got the nerves that come out of here. And these nerves in the low back, some of them come together and form the sciatic nerve that comes out of this frame in here. So it comes down, travels in the leg, feeds our feet and leg. We have a muscle that sits about right here called the piriformis. Our nerve comes right out above it, under it, or depending on your anatomy, through it. And that muscle, the piriformis, can cause sciatica on its own. It can bother that nerve enough to where we start getting that pain down the leg, okay? It can also be caused by inflammation or swelling in the area. It can be caused by injuries to the area that cause more swelling and more damage, right? So a ligament damage to some of the ligaments that are down in here. It can be gluteal tendinopathy, something like that can also create more swelling and pain down the leg, okay? Contrast that with a disc herniation that the root of the problem is up here, or facet arthropathy that comes down and pinches on the nerve here, right? So we need to be able to differentiate between sciatica and some other problem that is causing radicular pain or radiculopathy. Okay, so what are the symptoms of sciatica? So usually when we diagnose anything, the history and the symptoms are our biggest flags, right? That's going to guide our questions and our history, and it's going to guide our diagnosis and any tests that we need to do. Okay, so with sciatica, typically it involves intense leg pain, especially when you're walking or you're bending or otherwise stretching that leg out, and that causes the pain to shoot down the leg. That's going to be our typical sciatica. Contrast that with leg pain is just worse in the morning, right, which we normally see with disc issues, or you just feel it when you stand up and extend up straight, which is going to be more pathognomonic of facet syndrome, right? And so we're going to use these symptoms to boil it down to, okay, is our treatment for sciatica actually going to work for you, okay? So typically we see that leg pain. We can sometimes see numbness, tingling in the leg and weakness in the leg, but if we're starting to get that, that means it's pretty severe, and we're going to be looking at other structures within the spine. Okay, so what increases your chances for dealing with sciatica, right? First is history. Have you had it before? If you've had it before, it's likely that you'll have it again. And so if you're in that situation where you've had it before, then that maintenance, that preventative care is even more important for you to prevent repeated episodes of it, okay? Next, we have to look at just overall health. Sedentary lifestyles. Jobs where you sit all day or stand all day in one position increases your risk for it. Smoking increases your risk for it. Insufficient or weak core strength increases your chance for it. And a tight piriformis muscle, right? All those things can lead to a tight piriformis muscle. So our first thing that we have to look at is just lifestyle, right? Do you fit into that box where So to prevent and or treat sciatica, the first thing is to get active and stay healthy, okay? That'll reduce our overall chance of getting sciatica and a lot of other conditions. All right, guys, it's time to start talking about stretching and strengthening for sciatica. When we talk about sciatica, we often talk about certain stretches that'll help, but it's important that we strengthen the gluteal muscles so that they can withstand the load that maybe caused the sciatica in the first place, right? So we're going to talk about 3 stretches and then 2 strengthening exercises. The first stretch is going to be probably the most important for actually stretching the piriformis out itself. This is going to, you can do it sitting or lying down. I'm going to do it sitting for you today. You're going to take your knee up to your chest as high as you can go. This is going to start stretching the gluteal muscles in general. And then what you're going to do is you're going to take that knee and pull it over to the other shoulder. So it's going to be the opposite shoulder. And what you should feel is a stretch come along here right in that piriformis muscle, okay? You're going to hold it for about 10 seconds, no longer than 20. And just get a good stretch in that way. You can treat it like an exercise and do 3 sets of it. That's the first one, okay? So that's going to be a piriformis stretch. The second one is going to be done lying down on your back. And the goal of this is to stretch out the whole lateral part of your leg, also into your low back. So preferably do this on the floor. You're going to take your knee and stretch it over to the side. If you feel pretty confident here, you're able to get that rotation from your low back, you can straighten your leg. And here you'll feel a stretch across the whole leg into the low back. The third one is going to be called pelvic tilt. So I'll do this standing. You do it sitting, standing, or lying down. And what I want you to do is tilt your pelvis all the way back and then tilt your pelvis all the way forward. So we're really loosening up the low joints in that low back, and we're also engaging the muscles in the pelvis here. Okay, those are going to be 3 stretches for the piriformis. And then we're going to have 3 exercises for the piriformis. The first one is called clamshells, or it's most commonly called clamshells. This one's going to be done side lying. You're going to lay on your side like this, and you're going to pick this leg up, just like so. You do 10 reps of 3 sets. If this is too easy for you, what you can do is get a band, put the band around your legs, so you have some resistance. The key here is I don't want the leg to come straight up, I want it to rotate. And this is, we're engaging that piriformis muscle by rotating the leg into external rotation, okay? Just like that. The third or second exercise that we're going to do is glute bridges. Again, we're engaging these glute muscles here, so you're going to push through the hips up to about here. You don't want to go much further past, because that's going to start recruiting the low back, and that's what we don't want. And just like that. If it's too easy, you can throw a band around the knees, or you can have a kettlebell or a dumbbell on the hips here to increase the load, okay? And again, for this, you're going to do 10 reps, 3 sets. Always do both sides so that you strengthen both sides of the hip equally. And that's going to conclude our stretches and exercises for sciatica.